Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is about stroke. During this presentation, we will deal with what is stroke, its epidemiology, risk factor, symptom, where is the lesion, middle cerebral artery, anterior cerebral artery, Weber versus Benedict, Wallenberg-Pica, Locked-in syndrome, subarachnoid bleeding, aneurysm bleeding, diagnostic, CT scan versus MRI, treatment, TPA contraindication, mini stroke, and prevention. What is stroke? Poor blood flow to the brain that causes cell death. There are two main types of stroke: ischemic due to lack of blood flow, and hemorrhagic due to bleeding. Both cause part of the brain to stop functioning properly. Symptoms include inability to move or feel one side of the body, problem understanding or speaking, loss of vision to one side, and dizziness. Between 1990 and 2010, the number of strokes that occurred each year declined by around 10% in developed countries. In the same time, it increased by 10% in developing countries. In 2015, stroke was the second most common cause of death after coronary artery disease. About half of people with stroke live less than a year. Overall, 2/3 of stroke have occurred in people over 65. The main risk factor is high blood pressure. Other risks include smoking, obesity, high blood cholesterol and diabetes, previous mini stroke, end stage of kidney disease, and atrial fibrillation, AFib. Symptom of person after a stroke. If symptoms last less than 1 or 2 hours, it is transient ischemic stroke or mini stroke. Hemorrhagic stroke is associated with severe headache. Symptoms can be permanent, and long-term complications include pneumonia or urinary incontinence. Where is the lesion? A right middle cerebral artery stroke, left hemiplegia, hemisensory loss, hemianopsia, a deviated toward the right, and apraxia. A right anterior cerebral artery stroke, left hemiplegia, hemisensory loss in the leg, more than arm, confusion, behavior disturbance. Weber stroke, left hemiplegia, right ptosis, eye deviated to right and down, oculomotor tree. Benedict stroke, falling to the left, right ptosis, eye deviated to the right and down. Wallenberg-Pica, left hemisensory loss, right facial sensory loss, Horner, vertigo and ataxia. Paramedial branch of the basilar artery, it's locked-in syndrome, total paralysis. except vertical A movement. Anterior system carotid artery, posterior system basilar vertebral artery, between them the circle of Phyllis. This is the anterior cerebral artery, this is the medial cerebral artery, and this is the posterior cerebral artery. Anterior cerebral artery, medial cerebral artery, and posterior cerebral artery. Here is the basilovertebral artery, and here is the pica, posterior inferior cerebellar artery. Right anterior cerebral artery, arm and face, that small leg. Right medial cerebral artery, small head, but leg more than arm and face. Weber, left hemiplegia, right pulse. Benedict syndrome, posterior cerebral artery, oculomotor nerve palsy, cerebellar ataxia, and choreoatheotosic movement. Pica, many symptoms. Nucleus ambiguous, spinothalamic tract, inferior cerebellar peduncle, vestibular nuclei, trigeminal tract, and Horner syndrome. Let's start with Horner syndrome. Ptosis, meiosis, anhidrosis. Nucleus ambiguous, hoarseness, dysphagia, and loss of gaze reflex. Spinothalamic tract, contralateral body face, and palsy, contralateral body loss of pain and temperature. Inferior cerebral peduncle ataxia. Vestibular nuclei, vertigo, nystagmus. Trigeminal tract, ipsilateral face, and pain. An ischemic stroke is typically caused by blockage of blood vessel. A hemorrhagic stroke is caused by either bleeding directly into the brain, but also into the membrane of the brain. Here is the cranium, here is the dura mater, here is the P mater. Between dura and pera there is arachnoid, and it could be in subarachnoid space. And this is a bleeding may occur due to a rupture of brain aneurysm. Stroke common cause 20% hemorrhagic, 80% ischemic. Diagnosis based on a physical exam, medical imaging, including CT scan and MRI. Now, in that CT scan, rule out bleeding, but not necessarily rule out ischemia, which early and typically doesn't show up on CT scan. Other tests include EEG, a blood test to rule out other cause. Low blood sugar may cause similar symptoms. It's a differential. Best first step, no contrast CT to rule out hemorrhage. Most accurate test, diffusion weight MRI. Best for ischemia, CT can be negligent during the first 48 hours. A stroke or TIA often require emergency care. An ischemic stroke is detected within 3 to 4.5 hours. May be treatable within a medication that can break down the clot. Some hemorrhagic stroke benefit from surgery. Treatment to attain the recovery of lost function is called stroke rehabilitation. If within 3 to 4.5 hours, TPA. Later than aspirin, heparin only, if AFib or basilar clot. Contraindication to TPA, stroke within 3 months, surgery within 2 weeks, and LP within 1 week. When to clip an aneurysm within day or rupture or less than 10 millimeters. Fibrinogen to plasmine, TPA. Fibrin to D-dimer plasmine. Contraindication to TPA, sample stage. Sample stand for stroke or heat trauma during the last 3 months. A for anticoagulant during inert over 1.7 or prolonged PTT. Recent myocard infarction. Prior intracranial hemorrhage. Low platelet count over 100,000. Elevated blood pressure. Systolic over 185 or diastolic over 120. Stage stand for surgery in the past 40 days. TIA, mild symptomatic or rapid improvement. Age lower than 18. GI or urinary bleeding in the past 20 days. Elevated blood glucose over 400 and seizure present at the onset of stroke. Contradiction to TPA, sample stage. Transient Ischemic Attack, TIA. Definition similar to stroke, but less than 24 hours. Symptom resolved during 1 hour, often less than 5 minutes. Ischemia of the brain without infarction due to emboli or carotid artery. Pre-existing stenosis of the carotid artery. Arteriosclerosis plus emboli lead to impeded perfusion of the brain. Symptoms include contralateral paresia, weakness of the opposite side, dysarthria with blurred speech, vision problem, gait disturbance, and carotid bruit. Diagnosis, carotid ultrasound and CT of the head. Treatment, if the stenosis over 70% on arterectomy. Carotid artery stenosis, ultrasound of carotid artery. Prevention, decreasing risk factor, surgery for carotid narrowing, warfarin in atrial fib, aspirin and statin for prevention. Let's recap. Stroke common cause, 80% ischemic, 20% hemorrhagic. Best first step, no contrast CT to rule out hemorrhage. Most accurate test, diffusion weight MRI, best for ischemia. CT can be negligent for the first 48 hours. When to use endarterectomy? If occlusion over 70% and symptomatic. Over 60% and less than 60 years of age. Thank you for watching this episode of Medicine in 3 Minutes. Would you like to put the button like, to subscribe? Your comments are very welcome. Thank you.